Hello, good morning. My name is Chris, and today we're going to talk about some defects with high risk pregnancy. So, the first one we're talking today is hyperemesis gravidarum. So, it's a form of severe nausea and vomiting that happens to a pregnant mom. Usually leads to electrolyte, metabolic, and nutritional imbalances, and usually comes with a weight loss. Usually 5%, more than 5% of the pregnant weight. So when this happen, we restrict oral intake until the vomiting have ceased. We usually do an MPO for the woman, and we open an IV line that we use to replace the electrolytes. We usually do a normal saline or ELA, electrolyte ringer. We put the multivitamin, the magnesium, potassium chloride, and pyridoxine and thiamine are usually administered through the IV to make sure the woman gets most of the things that I've lost. So, pharmaceutically, we do a doxamine predoxine. So, we usually administer it to manage it, and non pharmaceuticals will usually advise the mom to take small frequent meals, a carbonated beverage, and to get small crackers, dry crackers in the morning when he gets up in the morning, and some high protein snacks. We're also going to talk about the multifetal pregnancy. Usually, when the fertilized egg is more than one, when we have like what we refer to as twins, have more than one egg fertilized, and this issue usually happens to a mom that have multiple uh, pregnancies. That's multiple gravidas. So usually results in bleeding from the placenta previa, abruptio placenta, and some gestational hypertension, maternal anemia. These are some of the manifestations, and it might complicate the labor because of the loss of the uterine tone that usually results from the overstretching of the musculature. And a C-section is usually indicated for the person with multifetal pregnancy. So to get it out. So we have the ectopic pregnancy. The ectopic pregnancy, usually when there's a fertilization, the fertilized egg travels all the way to the uterus where it begins to grow and develop. So some of the fertilized egg, stay in the fallopian tube. And when they stay in the fallopian tube, this is an implanted is referred to as what we refer to as ectopic pregnancy. So the treatment we usually do is a usually a surgical treatment called laparotomy. This is done when the fallopian tube has been ruptured. But if the fallopian tube hasn't been ruptured, we usually administer a medication called a methotrexate. This medication will help to dissolve it and stop the fetus from growing. We also administer the robo vaccine if the woman is negative. If it's RH negative, we usually administer the vaccine after the abortion. We have this another one is the spontaneous abortion. Is the termination of the abortion before the 20 weeks gestation. Mostly is caused by abnormal embryonic development. That's the baby. If it doesn't develop well, we also have a chromosomal effect from the mom, and also some inherited disorder from the mom can affect the baby and like autoimmune to lead to the baby coming out before being due. Also, there are usually a clinical manifestation that comes before it. It's like the bleeding, the abdominal pain, and the vaginal bleeding. So usually when there's bleeding, we have to monitor the H&H. We have to monitor for bleeding, electrolytes, to make sure the woman does not bleed too much. And if it's high, we have to administer blood transfusion to make sure the mom is okay. So another one we're going to talk about is the fifth one is the placenta previa. So the placenta previa occurs when the placenta implants in the lower uterine segments of the abdomen. This usually caused by multiple births and a history of C-section. So this usually manifests through a painless, breathless vaginal bleeding that occurs within the 20 weeks of gestation. The placenta usually separates from the uterus, and usually the C-section is scheduled when the baby gets to 36. Remember, it occurs when around 20, when the gestation is 20 weeks. So we begin to monitor the baby to make sure to see if we can manage the baby to get to 36 weeks before we get we can where the baby can survive to get the baby out. We usually administer a medication called betamethasone. So this metazone helps the baby to develop the lungs developments, because we are preparing for a preterm delivery. So we're going to make sure that the baby can survive outside the mother's womb. We also monitor the H&H because of the vaginal bleeding, to make sure the woman did not lose a lot of blood. And if it does, we're going to a blood transfusion will be indicated. Also monitor the fluid. Sometimes we also the fluid replacement will be indicated, and then we have the fluid and the IV and electrolyte replaced. So this is the end of this presentation. I believe you've learned from this. I can be Thank you for watching, and also I can be reached if you have any more questions. Thank you.